Welcome to Shaping Healthcare, a podcast by CitiusTech. I'm your host, Laurel Rockall. Today, we are joined by three experts in healthcare technology and operations. Shitang Patel, Vice President at CitiusTech, Jennifer Zellinger, Vice President of Product Development and Management at enGen, and Jennifer Magaro, Senior Vice President at enGen. With the combined wealth of experience in driving efficiencies and innovation across health plans, these three leaders will share their insights on how integrated and personalized care is shaping the future of healthcare and improving both patient outcomes and operational efficiencies. Welcome, everyone.
Good day, everyone. Thank you again for taking the time to join us today. We're going to discuss strategies for integrated and personalized care, and especially forging efficiencies while we try to deliver that. When it comes to such transformative healthcare solutions, practical experience is crucial. In that regard, I especially want to thank Jen Magaro and Jay-Z that are joined us from enGen. Look forward to hearing your perspective in terms of truly integrated solutions that can help deliver incredible experiences to our members and providers. First, let me set the stage a little bit. There are a number of headwinds and tailwinds impacting health plans and vertically integrated systems today. Political uncertainties aside, there are a few realities that we're dealing with. One is serious cost pressures due to economic outlook. Two is MLRs are way above our norms that we're used to. Three is margins when it comes to government program, government business continue to diminish. All the while, focus on consumerism, personalized care is still the most important objective that we have. Then if you shift the focus on technology side, there's numerous point solutions across front office, middle office, back office, and there's a need to integrate these to deliver a better experience. At the same time, there's AI and adoption of AI. What can AI truly do to help not only integrate the technologies and the data sets, but then create those insights and interact with those members and providers to truly deliver that experience? These are some of the topics and strategies that we're going to talk about today. So let's start with Jen Magaro, with you. Why are these integrated healthcare solutions important from your perspective?
Sure. So for many of us that have been in healthcare for a long time, our solutions were either created or acquired over many, many years. And those solutions were created to serve a very pointed purpose, or and they weren't necessarily developed with an end-to-end member journey in mind. That just didn't exist, right? That concept didn't exist at the time. So our thinking has shifted, and the tools available to us, including AI, have significantly shifted since those solutions were created. So as a result, our solutions are not efficient to maintain, and they experientially don't serve our members end-to-end very well. And so as we think about the significant administrative pressures, our investment dollars matter. And as we look to improve those experiences, or where we might lower our administrative costs, we have to look at how we can improve our NPS scores, how do we optimize our team members' time, and how do we really measure our ROI, again, investments, as we start to think about where are we going to put our dollars. So, again, if we think about how we might have invested dollars in the past, we would have looked at individual systems and investments. Now, as we start to think about a journey, right, and how we start to connect our dots, we look at an investment in our front end. We have to connect it the entire way through the back end. So again, that digital investment and something that we might surface to our member on the front end, we that nudge, or again, something that we might surface to our member. We have to think about, what does that paid claim look like, that submission and that paid claim? How does that then surface maybe to our care manager on the back end? And it has to be a full circle experience, right, that ultimately drives lower utilization costs, lower cost of care, and higher health outcomes for our members. So again, in the past, we would have looked at it and said, I want to make an investment in my digital experience, and we wouldn't have tied it front to back like we do today. So again, it's about the entire health journey. So a very different way that we think about making our investments than how we would have in years past.
Yeah. And certainly highlights the need for really bringing a lot of different data sets together and also kind of utilizing those to deliver that experience. So you mentioned digital a number of times, you mentioned experience a number of times. Let's kind of bring those two components together, right? That delivering that digital experience to our key stakeholders. Can we dive a little bit deeper in that? What does that look like for members? What does that look like for providers? You talked about some examples, but just wanted to go a little bit deeper there.
Yeah, so I'll cover members. I'll turn it over to Jay-Z to cover providers. When we think about the digital member experience, we think about it in four different components. I'll break it down into know me, guide me, support me in moments that matter, and then don't fail me in everyday moments. And so know me, think about that in I have to know everything there is to know about our member and how they're interacting with us and how they want to interact with us. So think about that as preferences, um, and every interaction that they might have had with us so that I can predict and guide them through the next interaction that they're going to have with us. Support me in the moments that matter is really about, think about the pivotal moments that happen with a member through their health journey. And again, think about someone having a cancer diagnosis. How do we show up in big ways in those moments that matter? Again, to support them through that journey and make that as seamless as possible, given that we know that that can be, again, a very a terrible moment, right, in their life. That again, we want to be there to support them through that and guide them through that process, and potentially their family members through that process to help that be as minimally disruptive, knowing that it's a disruptive process. And then in the everyday moments, right, we can't fail people. And I always liken this to, think about your experiences with Amazon. It just works, right? And we expect healthcare moments to just work. I need to be able to log in. I need to be able to check claims. I need to be able to find a provider. I need to know that they're, when I go to check how much I've paid towards my deductible, that the information is accurate and correct. All the things that I expect to do need to just work, and it needs to be seamless, and we need to show up each and every day. Again, nothing should fail. So if we look at the experience in those four categories, we can kind of break it down and easily categorize the way that we think about our investments.
Yeah, and to add to that, Jen, for providers, the key to a successful provider digital experience isn't just about a slick interface, right? It's about efficiency and reducing their administrative burden. Providers are incredibly busy, so anything that streamlines their workflows is gold. This means, real-time access to crucial information like a pre-authorization status, claims processing updates, or even patient eligibility. A fully integrated system that automatically pulls their data from their own EHR systems, eliminating that redundant data entry, is ideal, right? It's critical to letting them practice at the top of their license. We've seen gains in provider satisfaction when we've reduced the time spent on those types of administrative tasks, really allowing them to focus on what they're best at, which is patient care. I want to double click a little bit on the streamlined prior authorization part of what I just mentioned, because that's a big one, right? Could you imagine a system where much of the pre-authorization process is automated? Right? The system flags potential issues proactively, requires that minimal provider input, offers quick approvals or clear reasons for a denial or more information needed. Uh, Beyond that, secure messaging is essential for that quick communication with the payer, avoiding all of those phone tags and delays, because at the end of the day, we're all just trying to help the members get the care they need.
A few things you mentioned both from a member perspective and provider perspective, right? A lot of it, and I've been calling this out a couple of times, comes down to how you exchange that data, how quickly you're able to do it, and then subsequently, how does that data will ultimately turn into insights and get into the hands of decision makers. So I want to focus on that interoperability part to help bring the data together, as well as the interconnectivity within our internal systems within a health plan, right? To move that data and turn it into insights. What does this entail when it comes to kind of state of the art interoperability with your exchange partners, as well as interconnectivity within internal systems? JZ, can you talk about that a little bit more?
Yeah, absolutely. Interoperability is really the holy grail. It's critical, and it's not just about moving data, right? It's about moving it efficiently and in real time and gaining insights from that data. The biggest hurdle that I see is the assortment of the various EHR systems out there. Although we're seeing significant process or progress by focusing on several key areas. First, as I mentioned, is that real-time data integration or data streaming. That's essential. You don't want to rely on that batch processing. We need systems that can transmit data continuously because as members move through their care journeys, as providers jump in to help them, we need to know what's going on with them so we can in turn help them as well. We need to provide those immediate insights both to the providers and the members for that immediate decision making. Second, single sign-on is paramount. I mentioned before, you got to make this easy for the providers, right? They shouldn't have to log into multiple systems. A single secure login experience across all of that is really designed to improve their user experience. And then finally, minimizing the number of hops. The number of systems or steps involved in getting the data to the right decision maker, that's crucial. Every unnecessary step causes time, rework, extension of, if someone, going back to Jen's earlier point about, support me when I have critical moments. If a member does have that cancer diagnosis, they don't want to be sitting there waiting and the anxiety building. They need to have that information and know what's next in their care journey to address what they need right now. And so we're working through our platform, Predictal, our integrated care management solution, is connecting all of those data points to bring that together to make it easy for the payer and the provider to work together and reach those decision makers as quickly as possible.
I do want to talk about, so there's a lot of different complex things that we just discussed, right? Working backwards from what that journey looks like and kind of what we need to do from a health plan perspective to deliver that interconnected, integrated journey. And what are all the pieces that need to come together from a data standpoint, exchange standpoint, through interoperability, through interconnectivity. Uh, it sounds super complex, but going back to that practical experience, can we talk about what outcomes have we been able to achieve by doing this, by thinking about it this way, by creating Predictall in this manner? Can you share some examples of outcomes we have achieved?
Yeah, for sure. So with Predictal, as I mentioned, it's an integrated utilization management, case and disease management product. Let me share a couple of the outcomes. The improvements just aren't about numbers, but they do translate into tangible benefits for our members and providers. With case management, we've seen a 24% reduction in unnecessary emergency department use over the past 2 years. So that's significant improvement in patient care and cost savings. Member satisfaction is also exceptionally high with an average net promoter score exceeding 80. But it's not just about the patient and member satisfaction. Our internal operational improvements for that area are equally significant. We've managed to reduce administrative spending by 7% while simultaneously increasing productivity to a factor of 2.5. So imagine having the ability to outreach to 2.5 times more members just by leveraging the intelligent workflows and automation. And finally, these improvements have allowed us to achieve significant accreditation milestones, including a successful NCQA CM file review, which is not for the faint of heart. And so this is a testament to the effectiveness of our integrated approach of that improved interoperability. Now, that's on the CM side. On the utilization management side, the benefits have been equally as transformative. A few examples. First, we've seen an increase in payer clinician productivity. We're talking about a 42% increase in nurse cases handled daily and a stunning 56% increase for the medical directors in the cases that they're able to handle. But our overall productivity standards increased by 20% after the initial 6 months of go live. And so think about having a system change for an end user base. Expecting to have a 20% increase in productivity in just a half a year is huge. It's huge. And that efficiency, it extends to authorizations. We've moved over 70% to electronic submission, which then slashes that turnaround time by 80%. And one last stat for you. As equally as impressive are the cost savings, a 71% decrease in the average cost per authorization. And so all of that is as we continue to bring on new users to the system, that incorporates into a 50% reduction in our training timeline. So overall, external and internal benefits across a number of areas.
So that impact certainly sounds pretty significant. And as you mentioned, the impact would improve even more as we continue to evolve the platform and keep adding more users. When we talk about evolving the platform, I do want to talk about AI. It would be a shame if we did not talk about advanced analytics and AI and what that can do. I have a quote from Brett Taylor, who's the chairman of OpenAI board of directors. He recently said, "AI agents will come to encompass the entire consumer experience." Now, we have to take that with a grain of salt, knowing healthcare as an industry and the rate of adoption is significantly different than other industries such as retail. We referenced Amazon earlier, or finance. But how have we started to apply AI in Predictall or just in such integrated healthcare solutions? Can you talk about some examples of that?
Yeah, I can start. Happy to. So, AI, to your point, AI and machine learning, they're already transforming how we operate. And their role, we only expect that to expand. We're currently using machine learning in our member listening system, which is our ID and stratification product, to identify and categorize member needs with high accuracy, which helps us prioritize our innovations. And that information flows into Predictall, not in a monthly, weekly, or batch process, but as we receive new information on the member and run it through that machine learning, we're able to spit out the information every 15 minutes back into Predictall, so that allowing us to identify at-risk members much more efficiently and timely than we have before. We're also exploring within Predictall ambient listening opportunities for member calls. And so using AI to transcribe summaries and provide those real-time nudges to our care managers during the call.
And as we think about agentic AI and virtual assistant capabilities, right, in our digital experiences, uh, and AI around next best action, right, and how we surface nudges to our members. Again, we'll continue to look for ways that we can orchestrate those journeys in a way that goes back to guiding people towards, again, the actions that not only benefit them and the journey that they want to go on, but also the journey that we believe is the next, again, best action that they can take to help them complete the task that they're looking to complete.
Yeah. And one thing I can tell you, when it comes to cost of AI, every month, every other month, I feel like the costs start to come down with it, not only new LLMs and small language models when it comes to Gen AI, but just native capabilities from these cloud hyperscalers that are available to us now, that where we already pay licensing fees, and getting more juice out of them and getting more ROI with their native capabilities can certainly help the AI angle as well. Um, so we have talked a lot about what is this modernized platform need to be, how it needs to come together. I want to focus specifically on Predictall and your experiences. How do you truly differentiate Predictall against all other competitors in the market?
Yeah, happy to speak to that. Predictall is the core of our success with all of this, and it's been built on several different key differentiators. First, it's designed by clinicians and for clinicians. This was never a tech-initiated effort. We did a ton of chair sides and feedback with both clinicians and medical directors as we embarked on this journey. And the result is a workflow that's optimized for how providers actually work, both internally and externally. This clinician-centric approach is fundamental to the productivity gains we've seen that I've referenced before. the increase in cases for both nurses and medical directors, reflecting that streamlined process. Second, I want to call out its self-service configuration capabilities. These really empower the business users to adapt quickly to evolving needs without IT involvement, which further boosts the efficiency. So as they think about additional auto authorization rules or new gold carding programs they want to implement, the ability sits with them and not having to rely back on IT to do the work for them. Third, Predictal offers a real-time whole person view based on our ID and stratification process that I previously spoke about. And that's essential for proactively identifying and addressing those member needs, which directly correlates to that 24% reduction in the unnecessary ED visits. Those built-in integrations with clinical criteria content also provide extensibility and allow for custom medical policy integration. So we have the ability to bring that right into the workflow. You never want your end users to be swivel chairing to 20 different systems to grab that information. We bring it all together for them to make the most of their time. Beyond its functionality, Predictal has gained some significant industry recognition. And so we're proud recipients of the 2024 Class Points of Light Award, which underscores that positive impact it's bringing payers and providers together. In addition, it's NCQA certified or NCQA pre-validated for population health management in the health plan accreditation process. And we were also a 2024 PEGA Systems Innovation Award winner. And so I'm pleased that these awards help validate the Predictal's impact on not only improving those clinical outcomes, but the clinician experience and overall operational efficiency.
Thank you for sharing. That's extremely helpful to understand what the market looks like and what the top of the market should be and needs to be. Um, so I do want to conclude by talking about and looking into the future a little bit. So when we think about care management, UMCM, DM, when we think about customer service, when we think about claims management, and really integrating those key functions within a health plan, right? What does the future look like for us? Not only from a health plan standpoint, but also how the member and the provider will experience kind of what we are and how they interact with us.
Yeah, I would say it's got to be integrated. It's got to be easy. Mm, And from internally, right from their perspective, um, from from the payer perspective, it's got to be orchestrated, right? It can't be siloed. We've got to use the information that we have internally to make the experience again feel orchestrated and coordinated, so that again we're providing a much better experience than what we do today, because expectations have risen, and people will go find a better experience out there if one exists, because again if someone else will provide it, right, if we don't keep up with consumer expectations.
Yeah, I agree, Jen. To stay ahead, platforms like Predictal must continue to innovate, right? We need to continually invest in that research and development to incorporate those latest AI and ML advancements. This includes, generative AI and educational materials based on those individual needs. That integration we spoke about earlier, it's only going to get more complex, and we want to bring more of that data together to help drive that decision making. So continuing to enhance that data integration, not just bringing in more data, but making it easy, right? Making it easy to connect to those various EHR systems that ultimately helps reduce the burden on providers. Um, and while AI is going to be, a very powerful tool, it already is. Human expertise is going to remain essential. So we need to keep that human in the loop, right? We need to design systems that leverage AI to augment the clinician, to augment the decision maker, but to really help them and keep that process much more efficient. So I'm just really excited about the future of care management. There's a lot of opportunities.
Absolutely. And it is going to be fascinating to see when we think about this concept of whole member health, right? And personalized care. dare I say, personalized care is going to become more and more personal as we evolve, right? And I think that's something that we certainly look forward to. Jen and Jay-Z, thank you again so much for your time. This was truly enlightening, and we look forward to having more of these discussions in the future. To our larger audience, thanks for your time, and we look forward to seeing you again soon. Laurel, back to you.
It's been a pleasure having you all. Thank you so much for joining us today. The Shaping Healthcare podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.